Ladies and gentlemen, thank you very much for attending the press briefing. We're meeting here today in view of the unprecedented interest in the safety of the AstraZeneca vaccine. And I wanted to highlight how important we're taking the current situation and what we have been doing to make sure that we are evaluating any possible rare side effects relating to this vaccine. Last week, our safety committee, the Pharmacovigilance and Risk Assessment Committee, did review the preliminary results on the events of blood clots in people who had received the AstraZeneca COVID-19 vaccine. We said very clearly that the benefit risk remains positive. We have continued to evaluate. We have continued to receive additional possible side events. We have pulled in experts from across the network, experts with specific expertise in coagulation and thromboembolic disorders. So it's an ongoing process. So I'm not here to give you the outcome of any scientific review. I'm here to explain the steps in the process, what we're doing, and when you can expect us to come to a conclusion. So we're doing this review in the light of concerns that we see from citizens in the EU and the current situation, which means that our priority, which is to ensure the safety of the vaccine, can be communicated. I have to first explain that a situation like this is not unexpected. When you vaccinate millions of people, it's inevitable that you have rare or serious incidences of illnesses that occur after vaccination. And our role at the EMA is to evaluate these to make sure that any suspected adverse reactions are rapidly investigated so we can figure out, is this a real side effect to the vaccine or is it a coincidence? Now, to do this, we have mobilized our Pharmacovigilance and Risk Assessment Committee, which is a safety committee made up of mainly from experts from the national competent authorities from across the EU. But we also have patient representatives and healthcare professional representatives on this committee. And in this case, we've also pulled in experts from some of our international partners to help us with the evaluation. And we've pulled in experts who have expertise in thromboembolic events. Events involving blood clots, some with very unusual features such as low number of platelets, have occurred in a very small number of people who have received the vaccine. And these reports have been received through EudraVigilance, the European database for suspected adverse drug reaction reports. But of course we know that many people, many thousands of people, develop blood clots annually in the EU for many different reasons. So what we call on our expert committee to do is to establish whether there might be a causal relationship between the vaccinations and these events. In other words, whether the vaccines might have caused the adverse events that occurred or whether the events are likely to be due to other causes. So this requires a very rigorous analysis of all the data related to thromboembolic events, and the experts look in great detail at all the available data, but also at the clinical circumstances surrounding the specific cases to determine whether the vaccine might have contributed or if it's likely to have been due to other causes. Now, last week our expert committee met several times on this issue, but in the meantime, the interest in these events has actually stimulated additional reporting, so we're evaluating each of the incidences on a case-by-case event. So our experts are actually meeting again today. So having met most of last week, we have pulled together an ad hoc meeting again today to help us evaluate these cases with all the surrounding information that the member states will have. The experts will then carry on their assessment, and they again will meet on Thursday to come to a conclusion on the full information that has been gathered and to advise us as to whether there are any further actions that need to be taken. And we will inform the public of the outcome immediately after this meeting. I want to stress that our experts are working tirelessly to carry out this assessment as quickly as possible, but it needs a scientific evaluation. We need to have the facts first. We cannot come to a conclusion until we've done a thorough scientific analysis, and we owe it to the European citizens to deliver this clear and science-based response. So I want to also stress that at present there is no indication that vaccination has caused these conditions. They have not come up in the clinical trials and they're not listed as known or expected side events with this vaccine. In clinical trials, both the vaccinated people and the people who received the placebo have shown some very small numbers of blood clot developments. The number of thromboembolic events overall in the vaccinated people seems not to be higher than that seen in the general population. I don't need to remind you all here today that the COVID-19 pandemic is a global crisis with devastating health, social and economic impact, and it continues to be a major burden on EU health systems. Vaccines for COVID-19 help to protect individuals from becoming ill, especially healthcare professionals and vulnerable populations such as older people and those with chronic diseases. And this is a very important consideration in our assessment of the benefit risks. So while the investigation is ongoing, we are still firmly convinced that the benefits of the AstraZeneca vaccine in preventing COVID-19 with its associated risk of hospitalization and death outweigh the risk of these side effects. In the meantime, anyone who has received the vaccine and has any concerns should contact their appropriate healthcare professional. It's important that people who suspect that they have a side effect after vaccination report this to the national medicines regulator or to a healthcare professional who can help them to do so. Thousands of people are dying across the EU every day. We have authorised 4 highly effective COVID vaccines that can protect against severe COVID disease. These are very rare thrombo events or blood clots. We need to evaluate these very, very carefully. At the ad hoc meeting today, we will have a further update. But as I said, it's Thursday when we expect the evaluation to conclude. EMA is taking this situation very, very seriously, and we will continue to make sure that the European population is informed about the ongoing analysis of this assessment. Thank you very much.